Hello everybody, and especially for med students out there, a big hello. I'm Dr. Yan Yu, a family doctor in Canada. Today, I'm going to work with Dr. Glaucomflecken to show you how to really ace your family medicine residency interview. So as we all know, Dr. G pokes fun at what family medicine is now. But in my interview, I'm going to show you what family medicine could be. And because we all need healthcare at some point, we can all benefit by having a family doctor guide us through the healthcare system. Stick around to the end, and I'll show you how you can help make things better for family medicine and for healthcare in general. And with that, let's get started. Good morning, I'm here for the interview.
Huh? Oh, you're hired.
You guys really need some help, huh?
Yeah, you can have the job.
Well, I'd love to, but you can ask some more questions if you want.
Okay. How many patients do you want to see?
Enough so I can provide the medical care they'll need over their lifetimes, and still have time for myself and my own family.
How many different diseases do you want to manage?
Enough to be able to prevent them from getting worse in the future, but not so many that I bring them home to my family. COVID.
How much respect do you want to get for doing the most difficult job in medicine?
You know, I don't think it's about what respect we want. It's really more about fighting for the respect that we deserve. Respect from our specialist colleagues, our governments, the payers, the insurance systems, and the public. I think it's time to expose and end this hidden curriculum in medicine.
What do you think a typical workday looks like for a primary care doctor?
Again, it's not about the typical workday. It's about the workday we need right now, which is spending the morning seeing a manageable number of patients, giving them the time that they deserve, and spending the afternoon improving healthcare policies to reduce the systemic burnout of colleagues like yourself. And then, of course, spending a nice quiet evening with my wife and children. My real children, not my charts.
You're perfect.
Great! When shall we get started?
Right now, here are some patient phone calls, and some medication refills, and some prior authorizations. Welcome to family medicine.
Great. So there's some forms here that is actually appropriate for me to do, which I will do. And here's the stuff that my secretary can do. Jonathan, would you please see that these forms get done as soon as possible? Thank you. And here's the rest that we can send back to the source because this paperwork should never have existed in the first place.
You're perfect.
You don't yet have your own support system to delegate these tasks to?
Oh, yeah. Let me check. Oh, yeah. Our money tree still isn't making any money.
I think it's time that you are paid fairly. Paid what you deserve for the work that you do. So let's see what changes we can make here. What we've just seen is how the family medicine residency interview should be. This resident is already making life better for family Dr. Glaucomflecken. Now, ever since I released my last video reacting to Dr. Glaucomflecken and the family doctor going to therapy, many commentators have asked what they, the general public, and medical students yet to specialize, can do to help family doctors. So, in the next part of the video, I'll share 3 ideas with you on what you can do to help improve the state of family medicine wherever you are. First, society tends to value specialization. The myth that specialists are always better than generalists is just that, a myth. It might be true in some industries, but it is not true in healthcare. That's because these days, most patients have many complex, interrelated diseases, not just 1 or 2. Specialists are really good at treating the 1 or 2 diseases they know in their field, but only generalists, like family doctors, can navigate through the webs of complexity for each patient and deal with all their diseases simultaneously. Many diseases are also chronic, which means they last over several years. And it's that relationship with a family doctor who knows you that will optimize the treatment of those diseases over time. Small incremental improvements to health over time is oftentimes much more important to general health than a fancy surgery. So don't fall prey to the stigma that generalists aren't as good or as important as specialists, and help correct those who still think otherwise. Anytime somebody says something like, "Oh, they're just a family doctor," call them out on it. There is no such thing as just a family doctor. The second thing you can do is advocate for primary care and for family doctors. In many parts around the world, healthcare is governed by local elected officials. Call or write to your local elected official. to let them know the value that family doctors bring to you and to the healthcare system. And of course, to let them know that specialists aren't always better than family doctors. And if you can't find a family doctor, demand system reforms that will allow you to have one. And don't settle for substitutes that claim to be just as good as family doctors, but aren't really. For medical students in particular, you need to advocate for medical education reform. There is a hidden curriculum in most medical education systems that biases you against family medicine and primary care even without you knowing it. Think about it. Your lectures are grouped by specialty, not by undifferentiated clinical presentations. And lectures are almost always taught by specialists, not by family doctors. Even in your clinical rotations, your learning experiences come largely in the form of one-time consults, not ongoing relationships with the same patient over time. So in your training, you've most likely not experienced what a family doctor does, and you've not been taught about the value of following up with patients and seeing them through the course of a disease as it evolves. And sadly, you've not felt the joy of walking the journey with the patient, and especially to see them get better at the end of it all. And unfortunately, you've been constantly fed stories of family medicine as the overworked and underpaid suckers of the healthcare system. No wonder this deters many great students like you from pursuing this valuable specialty. That needs to change. We need more family doctors teaching students, more longitudinal clinical learning experiences for students, and better pay for family doctors so that more students will choose family medicine. Advocate for this. And finally, the third thing that you, the public, can do is to look after your own health. We family doctors want nothing more than knowing that you are healthy. Listen to your doctor and follow their health advice. Spend at least part of your day doing something that gives you a sense of purpose. Regularly connect with people who you enjoy and who bring joy into your life. Finally, don't forget the basics. Eat well, exercise, and get plenty of sleep. Sleep is often an overlooked way to improve your health. It is really the bedrock of good health in general. And for an overview of my guide to sleep, check out the next video that you'll see on the screen. And if you have any other ideas about how to improve family medicine, leave a comment down below. I hope you've enjoyed and learned something new from this video on how to really ace your family medicine residency interview. If so, please give it a like and subscribe to my channel for more fun reaction videos and medical education. Thank you, and see you in the next video.